Does anybody have any questions? Anything we want to go over? Okay.
Carmen?
Yes, sir.
Can you guys just comment about lymphedema? You know, I have a lot of patients, obese, you know, BNPs that are less than 100, no vein reflux, and you know, I live in a big city. We don't have a lot of resources for lymphedema treatment, and you know, I don't remember the last time I saw a lymphoscintigraphy. So, what are kind of the resources nationally, I guess, for people that are truly suffering from lymphedema, besides the compression, you know, therapy that takes a lot to get approved from insurance companies in the first place?
If it's primary lymphedema, there are several companies that sell lymphedema pumps that can be very helpful in these patients. Not if it's primary lymphedema, it's covered by most insurances. But you have to meet specific criteria, but they will tell you exactly what that criteria is and what wording you have to use to get that approved. I think that's probably true to some degree on some insurances and things, but most of them are covered.
You know, for that morbidly obese patient where you've got bilateral what really is bilateral lower extremity swelling, or more like a phlebolymphodema, honestly, the answer is weight loss, exercise, chronic elevation, compression, and you can use the pumps, but compliance with the pumps, I think, is a little bit of a problem. But that is a long-standing problem. Honestly, I try to use the calf muscle pump in these patients. I get them up walking. A lot of those patients are going to be sleeping in a chair, so their legs are chronically pressurized. So get them into bed, get the foot of the bed elevated with a couple of bricks, get that passive congestion, get them into compression and convince them that it's really important, and they do get better.
One other thing, if they ask them to walk in water about 10 minutes, 3 times a week, that makes a big difference in their situation.
And the sleep apnea.
Yeah.
So they're not hypoxic all night.
Yeah.
So I have a question to Dr. Sharifi. Do you know any study in the literature randomized that proved that intervention is beneficial on DVT, other than Sharawi's study, which is a small study, 20 patients?
Yeah, well, it depends on what you call beneficial. You see, if the endpoint has been post-thrombotic syndrome, we know that post-thrombotic syndrome is improved. Now, so at least you don't have the severe form. Then the second thing is, we are not, mortality is not necessarily the endpoint. If somebody's leg gets better, their symptoms improve, their edema is less, and their induration is less, that's for me an improvement. And we have 3 randomized trials. We have the Cavent, we have the Attract, and we have the Torpedo, which have shown the same thing.
It also did show a significant reduction in symptoms for the timing, right? So if you have a massively swollen leg as a young person and you're going to be in bed or on crutches for 30 days versus you can have a fairly low-risk procedure and get your symptoms better right away, which are you going to prove? You know, we're not talking about that part of this trial very much either, I think.
So the post-thrombotic is the one we talk about all the time, is perhaps we should drop it from analysis, really. It should be the immediate results, the best thing we do.